The population health portion of self-insured reporting was built by working with actual disease management nurses and building in the resources that they requested so that they could do their jobs very well. The clinical approach that our platform is based upon is referred to as the Asheville Project, and we would recommend that you take a look at it and you can research it. The Asheville Project is the most independently researched and peer-reviewed and studied disease management program in existence. It began in 1997 in conjunction with the University of North Carolina School of Pharmacy and the City of Asheville in North Carolina. And based upon that, there are many things that they've found that are things that you can do inside of a population, that there are protocols that you can follow specifically to have better member health and also to have lower cost. One of the major pieces of that comes into the identification of those individuals which have chronic conditions and then giving the platform a scenario in which we can very easily see who these people are. We can drill down to these individuals and we can also risk score them. So when population health nurses are working in our platform, they have a very robust way to search and get to members from lots of different ways. And then ultimately they can drill down to the member and have a 360 view of everything that's going on with this member, all of their conditions, subdiagnosis, procedures, all of their providers, all the drugs that they take, their chronic conditions specifically, what the risk scores are, what are the protocols. Protocols we separate are things that this individual can go do. For instance, they can go get a lipid profile. A lifestyle factor is a longer term conversation, so we segment that out so that it makes it very easy for someone who's working on site with a member to be able to help support them in their meeting their health goals. Also, it'll show prior health results, and you can even see scores of how their risk scores have changed and how their overall risk has changed over time. Similarly, with prevention, you'll see whether or not the person is compliant or not compliant with items such as getting their flu vaccine or a cholesterol screening. Ultimately, we can load labs, height, weight, note. It's an interactive platform where you can actually even bill. If you were billing on a per visit basis, that billing is actually built into the system as well. One final piece that we built in conjunction with working with nurses is that we found that although our system does a good job of measuring risk, there's no one who's ever in a better position to understand what the risk of this individual is than the nurse. One thing I'll show you here real quick, you'll notice this is de-identified on purpose. You could easily click to show the names if you wanted to, or you could hide the names. Now, one of the things that we built is the ability for, if a nurse is meeting with this individual, let's say, for instance, that it hasn't shown up in any type of claims, but they do know from meeting with them that this person has asthma. They can actually select and give this person asthma. What that will do then is all of the asthma protocols will show up on the right-hand side, and they can begin helping to assist to manage a condition that hasn't even shown up in a claim yet. One thing they can also do, let's say, for instance, that this population health nurse met with this person, and based upon their estimation of health risk assessments and what have you, they realize this person is a very high risk. What they actually can do, you'll see here, took a screenshot of what their current risk scores are. I'll put it off to the side. They can actually say, well, no, this person is actually a very high risk. I'm going to manually assign them as high risk. And from that, you'll see all of the risk scores are adjusted upwards based upon that nurse's input. Because again, no one is ever in a better position to understand this individual than a nurse, someone who's meeting and digging directly into this. So as you can see, it's a very interactive platform and one that you can obviously tell was built in working in conjunction with actual disease management nurses.